Thanks to all of you for joining us this morning. A special thanks to Senator Harry Reid, who the very fact that he's taking out time to come and speak to us indicates how strongly he feels about health reform and the need to make sure children are covered. And I also want to thank my colleagues from the American Academy of Pediatrics, Dr. David Talo and Larry McAndrews, who's president of the National Association of Children's Hospitals and Related Institutions. A lot of children in the United States depend on our extraordinary children's hospitals to help them when they really need medical help. These children's hospitals, which are in many communities around the United States, provide the final bastion of health services for those children with severe chronic illnesses and persistent problems that can't be solved in other places. They are the port of last resort for America's kids in terms of their health care needs. So the fact that the National Association of Children's Hospitals and Related Institutions is so strongly behind health care reform tells us something very important about access to those services and why there's such need and why we have to solve those needs. And to speak on behalf of the National Association of Children's Hospitals and Related Institutions, I'd like to invite my friend Larry McAndrews to come and say a few words.
Thank you, Erwin. It's a real privilege to be amongst you today, and I think it's one of the greatest strengths that we have in the country today, that so many of you are so passionate about making sure that children have access and coverage to health care. Let me speak just a moment about children's hospitals. There are roughly 200 children's hospitals in the country, and there are about 25% of our population, give or take, are children. But only about 10% of all the health care dollars are for children and children's health care costs. And so these 200 children's hospitals, these 3% of all the hospitals in the country, provide about 40% of all the care in the country. And the children's hospitals are both ambulatory as well as inpatient. And we work very closely with the pediatric community, and it's partly why we're here today. The pediatricians that serve as the front line of caregivers for children in their communities are directly involved in the care of children also in the children's hospitals. And so it's a very small community doing a very big job for children in the country. And we all appreciate the work that Senator Reid and Speaker Nancy Pelosi have done to ensure Medicaid, to ensure S-CHIP, and President Obama's support of these very vital programs. But what we also still understand is there are a number of kids that do not have access. They have coverage but no access. And part of that is that there are shortfalls in the number of pediatricians and in the number of pediatric subspecialists in the country. And a very real part of that problem is the adequacy of reimbursement and the support that's being provided to them to support their coverage. And so we are hopeful, very hopeful, that through health reform we will see these issues addressed in a very strong way so that we can assure that all children in the country have adequate coverage as well as access to the pediatricians and to the children's hospital services that they require. Because we know coverage and access really makes a difference in their outcomes, in the quality of care that they've received. And we know by improving that we will have a better future for this country and a better future for each of the children that we really love and care. When each of us think about the role and responsibilities that we have for the children that are in our own lives, we can understand directly the kind of care that we need to provide each of those children, to provide them a safe, secure environment. And as we think about that, all we need to do that for all children is to make sure that all of us are working together to provide that coverage and access that children in the country need and deserve. Thank you very much for being here, and thank you for support of health reform.